Welcome to CNTV. We bring you another episode focused on COVID-19, the coronavirus. I'm Brad Clonch.
And I'm Quin Tran. Social distancing remains in place to keep the infection rate down. COVID-19 is very contagious. A Chickasaw woman knows firsthand. She beat the virus, and she's now back on the front lines to care for others.
I'm Kinsha Walker, and I'm a Chickasaw citizen from Baton Rouge, Louisiana. I am a COVID-19 survivor. I was sick for over 2 weeks, and I'm healed and recovered.
Kinsha, we appreciate you connecting with us on this web program. Take us back a few weeks ago when you first started getting sick.
I'm pretty sure that I got the virus from work, but my husband started to exhibit symptoms about a day or two before I did. I was experiencing a cough too. So I walked into the bedroom, and my husband is wrapped in a blanket and he's shaking and he's shivering and he's running a temp. And all the symptoms of a temp. I got so nervous that I could not find a thermometer anywhere to take his temperature. And they had been taking his temperature before he started his workday every day. He's a captain at the sheriff's office in East Baton Rouge Parish in Baton Rouge, Louisiana. And they had also been taking mine when I would begin my shift at the hospital, and we were both showing no fever. So within 3 days, I was wiped out to the point where I was in bed so weak that I could barely get up. And they had to set up another virtual visit, and I said, I need to be tested right away. I'm pretty sure that this is COVID, because we had been fighting it around the clock with Theraflu and Tylenol, which was pretty much all that we knew to take at the time, and with no resolution. My husband and I would check on each other through the night to make sure that we were both okay. I mean, I do remember one night going to bed and saying to him, please check on me. Like, I don't feel good. Like, I really felt at that point like if something could seriously happen to me, and so I wanted him to check on me frequently, and he wanted the same. And so we did. And because I told my doctor, I said, we're not sick enough. I feel that, just my experience as a nurse, I can manage us at home unless we start having breathing problems. And thank God, neither one of us ever had any problems. I mean, the pain, just the chest pain is so intense. And I didn't want for him or myself to get pneumonia. So we would do, I would tell him to make sure that you're doing breathing exercises to try to keep your lungs expanding, because we can't afford to get pneumonia from this. The hardest thing for me, although I was so sick, was to manage in a way that my kids would not get it. So it was all of the energy that I had to get up several times a day to sanitize, because the kitchen was the area that we share with the we would come in at different times. We would avoid the same space as them, but there was times I had to go to the kitchen and my husband. So that was like a common area for us. So I would get up and wipe down everything, like sanitize everything, wipe down the refrigerator. That was like my worst fear, was my kids getting sick. And we did manage to do that. So if there's any good that came out of it, fingers still crossed, still praying, is that my kids have managed to stay healthy through all of this.
How many days did it take for you to fully recover?
It took 2 solid weeks before I felt well enough to feel a normal day. Cook breakfast for my family, do my chores around the house, just to maintain my house. But it took 2 weeks before I was able to do that. We made it. We survived.
And what's remarkable about you is now that you've recovered, you're back on the front lines and helping patients. You're from Louisiana, but now you've traveled to New York City. Tell me what you're doing there.
Yes. So I am here with a group of nurses and doctors. There's some nurse practitioners, and we're here to help the healthcare workers in New York take care of the patients here. I was asked to come here before I got sick. And at that time, I thought, there is no way. And during the time that I was sick, it allowed me to put a lot of thought into how I could make the best of my situation and how I could how I could assist and care for others. So I decided to come, and I'm working in Harlem, in the Harlem Hospital, where there is a lot of need for help. There have been so many sad stories that I have heard since I've been there. Been at the hospital a week now. I see now, since we've been here, that it's not as full as it was. Like, we have empty beds now. We're still getting patients admitted to the hospital, but I think it's now we are better prepared. We have more help, and we are able to get people more healthy enough to be discharged from the hospital. And I think a lot of it is also too, people are being educated more about staying in and taking additional precautions to keep from getting. So that's helping. That's helping our numbers decrease too, as far as the hospital admissions. I have a patient that I'm taking care of now, and which mostly we get moved around to different units. That's been there for 22 days. The length of stay it's longer for the patients.
What are the difficulties in caring for patients with this illness compared to anything you've ever had to do as a nurse?
First of all, just keeping that mask on for a 12-hour shift, it takes a couple of days for you to get your lungs used to wearing it, because you're used to having much more air. With your scrubs, you have to put a gown or a suit over your scrubs, and then when you enter into the rooms, you have to put on a plastic gown over that with goggles. You have to have your head covered and almost completely covered in order to enter the rooms, and you have to put on 3 pair of gloves.
At the end of your 21-day service there in New York City, what are you going to bring home from your experience?
Service matters. Wherever the need is, I'll go. This virus affected every system in my body from head to toe. So it requires every ounce of energy you have to fight it. And a lot of it is just the determination to do so. But if you have to have the willingness and the encouragement, and it's nothing more helpful, I feel, to my patients to tell them, I have been where you are. I know how you feel. We have to get through this. And, I had a young lady say to me today, really? I said, yes, I know how you feel, but we're going to get you well enough so that you can get home and get back to your family.
This hasn't broken your spirit as a nurse or as a person?
I've always tried to live by my motto that says that many are called, but few are chosen. And I know, and this is confirmation to me that this is what I was chose to do. And that this is where my heart is. After I became sick myself, I knew that I needed to go to help others who were COVID patients as well. I knew this is where I needed to be.
It's truly a calling for her to serve others as a nurse. We're so glad she's doing well and now helping others get through the illness.
We appreciate her and other healthcare workers. We can do our part preventing the spread of the virus. Health officials urge people to wear cloth face coverings when out in public, making sure the mask properly covers the nose and mouth. Some people are asymptomatic, showing no symptoms, and might expose others to the illness. The face coverings help prevent the spread, along with social distancing measures. Doctors remind us that elders and those with underlying health conditions are at high risk.
No, we aren't going to be able to let down for a long time. It was really clear because in the plans that you see, there is individual responsibility in all of them throughout this whole time frame, however long it lasts. If individuals start letting down, too soon, start congregating before we have control of the virus and things like that, it can go back up quickly and easily. So yes, there's going to be, it'll be a long, long battle, longer than anybody wants it to be. Let's put it that way. But I feel pretty confident we're doing a really good job within the Chickasaw Nation, our government entities, our business entities, and also our health system.
The Chickasaw Nation has this COVID-19 hotline. Call this number with questions. Patients with signs or symptoms will also be assessed over the phone. More COVID-19 testing is underway.
The Chickasaw Nation is adding a 4th testing site. That one is in Tishomingo. This is the first location set up at the Chickasaw Nation Medical Center in Ada last month. Drive-through test sites are also in Ardmore and Purcell. Tents are located in parking lot areas with medical equipment to assess patients quickly. People remain in their vehicles for the nasal swab tests. The testing centers are open to everyone in the public. We connected virtually with the Chickasaw Nation's pathologist to learn more about COVID-19 testing.
This is the Abbott ID Now instrument. It's the rapid test instrument for COVID-19. And these are the test kits that are utilized for this instrument.
Dr. Kevin Maddox is the Chickasaw Nation's pathologist. Through this virtual meeting, he explains how the Abbott test works to detect COVID-19.
This is the swab that would be placed in the patient's nose, the back of their nose, and sent down to the lab. This cartridge, the base cartridge, is placed inside this well here, and this is closed back up, and it'll heat the solution inside this cartridge for 3 minutes. After the 3 minutes is up, the instrument will prompt you on this LED screen to mix your sample within the solution of this cartridge. So you mix the patient's swab in there for 10 seconds. After the 10 seconds is up, you take this, which is a pipetting device, and you'll insert it into this cartridge with the solution in it, pipette the solution up into this, and place it into the base holder right here, and it snaps down. You close the lid, and a timer will begin, and it will let you know that it's being tested. Timer is set for 10 minutes on it, but if it's positive, it'll typically indicate a positive result within 5 minutes. And if it is negative, then it takes about 10 to 13 minutes for a negative result.
Why longer for the negative result?
Because this is it's highly sophisticated. It's a molecular test, but it detects the genome of the virus, and there's a probe in this solution that will detect a certain genetic sequence of this virus. So the process is called PCR, polymerase chain reaction. And what it does is the probe will find a certain region of the virus genome attached to it and cause that genome to start replicating, and you end up with more and more viral RNA. And so sometimes it can, it takes a little longer to call it a true negative. It would take longer for that genetic material to appear and be detected, just to be sure that it is a true negative.
As a pathologist, this is a great technology to have when you can tell a patient or tell a provider within minutes.
It's a great benefit to our facility, and our clinicians love the fact that we have it, and we're just doing our best to provide quality, safe patient care.
Let's talk about serology testing, which is an antibody test that can help detect and determine if you have the virus or have previously been infected by the virus. Are we anticipating getting those types of tests equipment?
Yes, we are. We are in the process of acquiring an instrument, and that will give us the capability to detect antibodies that will allow us to tell patients that, yes, you had the virus or you came in contact with the virus, but that doesn't necessarily confirm immunity.
Dr. Maddox, in your career in pathology, is this just a very unique time to be practicing medicine?
Absolutely. Absolutely. These are uncharted territories for myself and, frankly, every other provider across the country. But I'm hopeful because I feel that the proper measures have been put in place. And so as long as we remain vigilant and continue our social distancing measures, we'll get through this.
Testing is key to detecting the disease and tracking its spread. Look for more updates on this in the coming weeks.
Meanwhile, many community efforts are underway to help families. Partnering with the Chickasaw Nation, Walmart donated more than 30,000 pounds of produce. Using drive-through delivery, the tribe's nutrition services help distribute the food to Chickasaw citizens and CDIB cardholders. The food distribution was set up at 2 different locations, the Chickasaw Nation Medical Center in Ada and at the Chickasaw Nation Tishomingo campus.
Those of us in nutrition services and really across the Chickasaw Nation, those that provide direct services, it is such a rewarding experience. And this was really just an ideal time to showcase how we were able to help and see the smiles and the thankfulness of those that we were able to provide assistance to during this time.
A total of more than 2,200 vehicles went through the drive-by food distribution in Tishomingo and Ada.
With more families at home and kids homeschooling, nutritionists say the kitchen can be a great classroom.
You can learn lots of math skills and science skills in the kitchen. Pull out some fractions, some measuring cups, and have them go through that. Just going through some basic measuring techniques. You can use a lot of those math skills in the kitchen. When it comes to science, exchanging ingredients for something else to kind of see how it tastes or see how it works out. If it's a fail, that's okay. That's part of science, and that's how recipes come about. And so using this time to get your kids in the kitchen, making it fun, and really, I think, bottom line, boosting that kitchen confidence for them.
Here's a great resource for cooking. The Chickasaw Nation's Get Fresh program has a new website featuring more than 600 recipes. Go to getfreshcooking.com for easy and nutritious recipes. Thanks so much for spending some time with us here on CNTV.
Stay healthy, and we'll see you next time.